Well, we are still tackling the current COVID-19 pandemic, but are we preparing for the next pandemic? Former FDA Commissioner Scott Gottlieb was in regular contact with key players within the Trump administration as the coronavirus pandemic gripped the nation. And despite vaccine rollouts and mandates, more than 700,000 Americans have died from the virus since the onset nearly 20 months ago. Critics argue that system-wide failures across government agencies left the country extremely vulnerable. Has anything changed? In Dr. Gottlieb's new book called Uncontrolled Spread, Why COVID-19 Crushed Us and How We Can Defeat the Next Pandemic, he says that the U.S. made major mistakes during its response. And Dr. Gottlieb joins me now. He is also a member of Pfizer's board of directors. Doctor, thank you so much for joining me. Gotta say, I thought I knew pretty much everything about how things unfolded with this pandemic. I found your book really illuminating, and I want to get into it, but I want to kind of start with some of the issues that we are currently facing, and it kind of overlaps with the themes that are in your book, to tell you the truth. First off, you're on the board of Pfizer. Pfizer is seeking approval for its vaccine that it says is safe and effective when it comes to children as young as 5 years old. So this is my question to you. We've been told over and over again that children are less susceptible to the virus, and there's going to be a segment of the population, parents, that are still going to be really weary about getting their child inoculated. Do you think that vaccines for children will be the game changer that we need to overcome this pandemic? And why? And what will you say to parents who are still quite skeptical?
Yeah, well, thanks for having me. Look, I think it's certainly going to be helpful. I think that there's a lot of adults who've been vaccinated who understand that the vaccines protect them and they're not at significant risk of a bad outcome from COVID, hospitalization or death from COVID, because the vaccine's protecting them, even if they're still susceptible to a breakthrough infection. But their anxiety is that they could develop an asymptomatic or mild infection and bring it back into the home where they might have young children. So I do think that having a vaccine available for young kids is going to help restore confidence and return us to a sense of normalcy. Now, you're right that there are going to be parents who are reluctant to use a vaccine in their children. We've only seen about 50% of eligible children ages 12 and above actually get the vaccine. I think people need to understand that lower risk for COVID, and thankfully children are at lower risk from COVID than certainly older adults, doesn't mean no risk from COVID. And we have seen bad outcomes in kids. We've seen kids who've developed infections and have residual symptoms of COVID, including neurological symptoms. This is a virus that we don't understand well. And the more we learn about it, the more we're learning that it has some sinister long-term consequences in a small cohort of people. So I think we want to do all we can to try to protect children, make sure they don't get infected, try to avoid large outbreaks in schools. And when vaccines are available, talk to your pediatrician and consider getting your child vaccinated. I have young kids. They'll be eligible for the vaccine when it's authorized for ages 5 to 11. I certainly plan to vaccinate them. I think it's going to help them, restore their lives and be able to do more things that right now, we're a little reluctant to do because of the risks associated with this infection and putting them in settings where we know that it's conducive to spread.
Should the vaccine be a requirement like other vaccines are for children to go to school?
Yeah, look, some states and local districts are going to make the decision to mandate vaccination right now. California's obviously done that. I think that it's likely that this vaccine will eventually get incorporated into the childhood immunization schedule, but I don't think it's going to happen certainly this year. I think it's probably something that maybe will be considered in the fall of 2021, winter 2022, the next school year, because CDC will want to make sure that the vaccines are fully approved for children before they consider adopting it as part of the childhood immunization schedule. And I also suspect that they're going to want to have more than one vaccine on the market. So there's competition on the market and choice for parents. And right now, the only vaccine that is likely to come onto the market, at least for the foreseeable future, is the Pfizer vaccine, just because it's a little further ahead, the company I'm on the board of, in terms of filing the application. So I think that mandates in terms of the vaccine being incorporated into immunization schedules is probably not something that's going to happen this year on a wholesale basis or a national basis. Some states and some municipalities will take that up, though, and obviously California has already done that.
So I want to ask you about an announcement that Merck released last week that was kind of made a big splash. They're talking about a pill that they say their trials show reduces hospitalizations, reduces deaths by half. This, not to sort of use another cliche, but this could be a game changer. They're seeking federal approval. But there's only, I think, 1.7 million courses of treatment. One of the themes in your book is that there's sort of chronic shortages on all levels. If this is so effective, why don't we have more doses?
Yeah, and this is something I talk about in the book, which is that we don't have the capacity in this country to really scale production, the kinds of countermeasures that we need in the setting of an emergency. And I talk about ways that we can invest in having that capacity. I mean, there should have been a little bit more planning here. 1.7 million doses of this drug is probably enough to have covered us for 1 month of the Delta wave, given the indication in which this drug is likely to be used. To give you a basis of comparison, there's somewhere between 50 and 80 million courses of therapy for flu in the strategic national stockpile as a hedge against a feared pandemic involving influenza. So 1.7 million doses is really a rounding error in the amounts that we thought we would need in the setting of a pandemic. This drug looks very promising. This is probably the most profound treatment effect that I've ever seen from an orally available drug used in the treatment of a respiratory disease. So this is quite a meaningful finding because the results were in a population of patients who had risk factors for COVID, and they were treated after they developed symptoms, after they developed mild or moderate symptoms of the disease. So they were fairly advanced in the course of their illness, and yet you still saw a very profound treatment effect, a 50% reduction in hospitalization and death.
The other conversation that we've all been having is about booster shots. Who should be eligible? Should we be doing this in general? Because, as you know, as we're debating a third shot, there are countries around the world that, that their vaccine rollout is woefully inadequate. Can we ever get over this pandemic if we cannot ensure that most of the countries around the world reach some sort of herd immunity? Should we be talking about booster shots now?
Yeah, look, I don't think it's a zero-sum game between using doses available in the U.S. to provide booster shots and making doses available outside the U.S. There's going to be a lot of supply coming on the market. Somewhere between 10 and 15 billion doses of vaccine are going to be produced over the next 12 months between all the different manufacturers that are currently in the market. And there'll be other people entering the market. We've already distributed about 5 billion doses globally. World population is 7.5 billion people. So a lot of people have already been vaccinated. Now, the challenge is getting it into certain austere settings, developing countries where you don't have as good infrastructure. I don't believe this is going to be a supply issue in the near term or the long run. I think it's going to be more an issue of capacity in those markets to try to get on the ground and start distributing vaccine. As far as the doses being used in the U.S., the booster doses, the U.S. has already bought those doses and effectively stockpiled them or secured them. And those aren't going to be used outside the U.S. regardless. The Biden administration is going to want to hold on to a certain amount of vaccine as part of national security preparedness to make sure that we have vaccine on hand if we have to re-inoculate the population if something should happen with this virus. So these boosters that are being distributed in the U.S., which aren't going to be a large sum, we're talking about tens of millions of doses, really aren't shots being taken away from other countries where they could be used. It just doesn't work that way. As far as who should get boosters here in the U.S., the CDC and FDA have clearly said people over the age of 65 and those who live in long-term care facilities should go out and get boosters given the risk reward. For other people, they have to judge their individual circumstance based on their underlying health conditions and whether they work in occupations that put them at excessive risk of COVID disease.
So, Dr. Gottlieb, like I said, I thought your book was great. I could talk to you for hours about it, but we have a limited amount of time. So, the CDC gets a lot of criticism in your book about how they managed this. They had a system that was set up, a general plan that was set up for a flu virus. This virus turned out to be nothing like that. They kept information, they kept technology, and generally it seemed as if the CDC was not willing to be honest about its limitations. And there are so many examples in the book. My question to you is, should the CDC be managing a pandemic like this? Do we need a new organization? Do we need a more robust, expanded CDC? How do we fix it? Because it was clear that we did not have the organizations in place to tackle this pandemic the way we should have?
Yeah, the CDC really didn't have the logistical capacity to mount a public health response to a crisis of this magnitude. And culturally, it really wasn't the right organization. It's a high science organization that's accustomed to doing very exquisite scientific analysis and taking its time to try to be the definitive answer on important scientific questions. It's not an agency that has sort of a national security mindset and can mount a robust logistical response and forward deploy diagnostic tests and manufacture diagnostic tests and surface real-time information to inform current policymaking, which is what you need in crisis, and even issue guidance to the public in a way that it could be readily assimilated into how we make decisions about reducing our risk in our daily lives. I don't think that it's going to be a question of building a new organization. I think that probably would be the wrong approach. I think it's going to be a question of building in the right capacities in the CDC to be a hedge against these kinds of risks. We need to look at public health preparedness through the lens of national security preparedness and try to build out institutions and infrastructure to take on crises of this magnitude. We don't have that right now. I think in retrospect, what we should have done is recognize CDC didn't have the capacity and probably married it to some of the agencies that did have more of a logistical capacity, like the FEMA agency that deals with national disasters, and maybe even the Department of Defense. Ultimately, we recognize that we didn't have agencies that had both the scientific capacity and the logistical capacity to deal with some of the challenges we face in the setting of COVID. And that's why we created Operation Warp Speed. Operation Warp Speed was a marriage between NIH, FDA, and the Department of Defense, recognizing that you needed to get the scientific aptitude of NIH with the regulators together with the Department of Defense that had the capacity to do the manufacturing scale up and distribution that was required to get vaccines to the public. So we don't really have the infrastructure we need right now. We need to build it. I think we're going to have to build it within the CDC rather than try to create a new agency from scratch.
And, you talk about this also being a national security issue, not just a health crisis. And I was also struck, even though I knew this, I was struck by the limited information or outright no information that China provided, the ways in which China made it challenging and difficult for any kind of investigation to get to the root cause of this virus. And I thought to myself, there have been other viruses coming out of this area of the world, coming out of China. There's SARS, the avian flu. This is going to happen in the future. If China refuses to live up to its obligations and its agreements when it comes to this sort of stuff, its agreements with international organizations, how should this be addressed moving forward, Doctor?
Yeah, I mean, in the book, I talk about getting the national security agencies more engaged in this overseas mission. Our spy agencies, the CIA, the NSA, we've seen time and time again countries withhold information about emerging outbreaks and emerging infections, including the Chinese government. They did it in the setting of SARS-1. We strengthened the international health regulations, which are governing principles put out by the WHO, the World Health Organization, on what countries have to commit to in terms of sharing information when they have an outbreak of a dangerous new pathogen. And we've seen countries just flout those regulations, including China in the setting of SARS-CoV-2 and setting of this coronavirus. So I don't think we can rely anymore on just the good graces of other nations to, agree to share information. If anything, COVID conditioned the world to be even less forthcoming because COVID normalized trade and travel restrictions as a way to try to contain outbreaks. The first thing that happened when the British announced that they had the more contagious variant B117 is the French closed the channel. So we're going to have to rely on tools that allow us to gather this information proactively. And that's going to be our national security agencies. It's going to be our spy agencies. They have to get engaged in this public health mission.
Doctor, before I let you go, I got to tell you, after going through your book, I felt less confident about our capabilities to handle another pandemic. Should I be?
Well, look, what we've done is we've identified what our weaknesses are and our gaps are. And now recognizing that, I think we're in a better position to start to address them. I don't think we've really started to address these things in earnest. And that was really the purpose of the book, was to hopefully be part of that conversation. I don't think we're a lot better prepared today than we were, 3 years ago, but for the fact that now we recognize what our weaknesses are.
Should we be able to gather for Christmas? Dr. Fauci says he doesn't know.
Yes, we'll be able to gather for Christmas. I think people need to judge what the prevalence is in their community and what their circumstances are. If you have young children who are unvaccinated and older individuals who are at risk, maybe you use testing as a way to just secure that setting. But there are ways that we can gather safely, not just for Christmas, but Thanksgiving. And I'm sure we'll be doing that.
Dr. Scott Gottlieb, thank you very much. Really appreciate your time.
Thanks a lot.